Well, this morning, a look at how the VNA is making an impact in our community, one patient at a time. This kitchen is a special place for Robert Wilson.
I love to make people happy with food, and so being able to do this and it's my happy zone.
It's been a long road to get here.
I've been struggling with addiction since I was a young teen, drugs and alcohol.
His addiction almost took his life.
But at the age of 45, it had taken everything from me, brought me to my knees, and it was either live or die. And I had made the choice to die. But divine intervention got me off the floor, and I went to treatment.
A detox center recommended the Stevens Center for Help.
They said it's an emergency homeless shelter, and the realization of what I'd done to my life and myself hit me like a ton of bricks. I'm like, man, I have to go to an emergency homeless shelter.
But this is where his life began to change for the better.
I'm gonna throw some mayo in there.
Beginning with his first encounter with visiting nurse Lisa Edmondson. Lisa is one of the visiting nurses who serve every homeless and domestic violence shelter in the metro.
People coming into the shelters are coming in with a lot of stress and anxiety, not knowing where they're going to sleep or where they're going to eat. Healthcare was always on the back burner. People aren't taking care of themselves.
She gets their health back on track as a first step.
We will sit down with somebody, help them identify what their healthcare needs are.
I was embarrassed to tell her that I hadn't been taking care of myself. And that embarrassment went away quickly as soon as she started talking to me, and I could just tell that she really cared.
Lisa discovered once people feel better,
they can get their self-esteem back. They can start feeling better. They can start promoting to go get a job, get employment, get their own place.
That's exactly what Robert did.
What Robert had was a passion. Robert had a goal, and Robert had a culinary skill as a gift. So from the very beginning, he was volunteering in the kitchen, chopping food and making meals, just as he's living here. He continued to grow and to get his own place, get employment. And it's come full circle to where he's back at the Stevens Center as the food service director.
10 years later, Robert is now serving up food. And every now and then, a little advice for others who are now seeking help.
Don't be afraid to ask for help. It's amazing to be able to give back what was so freely given to me. Every day I come to work and I see myself on the other side of that line. And it keeps me in check on how I treat people.
For Robert, having someone who cares.
Lisa's really good at checking on people. She's really good at, are you doing that? Are you doing this? Did you make that appointment? So over the 10 years, we've become really close friends. And now I take care of her and I serve her. When she's on a diet, I'll make sure her salad's got grilled chicken on it.
And doing what he loves is the perfect recipe for success.
My life is amazing today.
Just one of the many success stories. The VNA says COVID has tremendously impacted visiting nurses and their clients. Their clients were some of the first people to lose resources during this pandemic, including their jobs and health insurance, which means they lost access to health care. So the visiting nurses have been filling in the gap. They also perform COVID testing and immunizations while continuing their work at the shelters. Now, the VNA relies solely on the generosity of the community. So if you would like to donate on the Day of Action, you can go to uwmdayofaction.org.